Hello students, welcome back to Easy Nurse, where nursing education made easy. So tomorrow is your upcoming exam. Are you worried about your exam? Don't worry, we are Easy Nurse here for support you and guide you. If you follow our live class today, so you will definitely crack your exam with a very good score. So let's start about today's sessions, and in these sessions we are going to discuss regarding the questions pattern as well as how to write the exams, and I am giving you the tips how to crack the exam. So let's start. So first in this session I am going to discuss regarding the community health nursing one. So previously in one session I already discussed about the community health nursing along with the nutritions, right? So mainly in this session I am going to cover each and every topic of the community health nursing one, including nutrition, environmental hygiene, as well as the communication, health education, everything. Okay, so let's start. So first we are going to see regarding the questions pattern. So see, first it will come like give the meaning of the following. So into this the meaning they will contains the 4 questions. Okay. Next come to the fill in the blanks. In the fill in the blanks they are going to cover 4 questions. Next come to the short notes. So in the short notes again 4 questions they are going to cover. Then answer the following. Into this there contains about the 4 questions, and next is the true or false. Same true or false also 4 questions they are going to cover. Short notes in the 3 questions they are going to cover it, and in the answer the following into this they are going to cover the 4 questions. Okay, so this is the main questions pattern, and I prepared some this questions paper by following the previous year questions paper as well as the important basis notes and topics. So let's start, and now in this sessions I am going to discuss regarding all the answers of this particular important more questions. Okay, so let's see. First I am going to see regarding the give the meaning of the following. Okay, so meaning means obviously you have to write what is the actual meaning of this particular topic. Okay, so see, first is the family health care. So what do you mean by the family health care? It's nothing but it's a broad approach in our healthcare professional which is mainly emphasizing the health needs as well as the problems for the individuals, which is mainly contexting with the family unit, and it's also include the physical, mental, social well-being as well as the preventive, promotive and curative services aimed, which is mainly maintaining the health for all the family members across their lifespan. So that is the family health care. So as a community health nurse, when we are going for the family visit as well as the home visit, so our main goal to detect all the problems what they all are facing in each and every family members. Okay, so based on that we have to give the proper care. So that is the main aim of the family health care. Now come to the next question, that is environmental hygiene. So what do you mean by the environmental hygiene? It's nothing but it refers to the branch of the public health which is mainly concerned with the factors in our environment which can potentially affect our health, like sometimes sound, sometimes noise, physical which is mainly impacting our physical, chemical as well as the biological factors such as our water supply, waste disposal, air quality, then housing as well as a vector borne for ensuring a safe as well as a healthy environment. So that is called environmental hygiene. So how our environment is going to impact as well as affecting our normal healthy lifestyle. So that is the main considerations of the environmental hygiene maintenance. Okay. Next, move to the primary health care. So what do you mean by the primary health care? PHC or primary health care, it is a very essential health care which is made universally accessible for the individuals and the families in our community through the full participations and at a cost to the community as well as the country they can afford. So it's a very low of cost. They are going to provide the basic treatment for the people. Okay, so that is the primary health care, and it is the first level of the contact with the health system, as also is going to include the promotive, preventive, curative as well as the rehabilitative services. Now come to the next question, that is immunization. So what do you mean by the immunization? Immunization is a process of making a person immune or the resistance to an infectious disease, which is typically by the administering a vaccinations, and it's also going to stimulate the body's immune system for recognize and fight the pathogen, which is mainly providing the protection against some the specific disease. Okay, so if you say about the immunization for each and every age group of people, there are separate immunization schedule is there, right? So as example for the pregnant woman, so there are two types of the immunization is there, that is TT, tetanus toxoid dose 1 and tetanus toxoid dose 2. So mainly tetanus toxoid dose 1 you have to give in the early pregnancy, and tetanus toxoid dose 2 you have to give after the 2 weeks of the first dose. Okay, after 2 weeks of the first dose. So that is the like basic schedule for the pregnant woman, the tetanus toxoid dose 1 and tetanus toxoid dose 2. Same as like for the infant baby at the birth, what type of immunization we have to give? As example BCG, hepatitis B, then OPV 0 dose, as well as the vitamin K. Okay, so BCG where we have to give 0.5 ml through the IM through the ID or the intradermal. Next, hepatitis B we have to give 0.5 ml through the IM, and the OPV we have to give as a orally 2 drops, right? So these are the basic immunization schedule. Okay, now let's move to the next topic, that is fill in the blanks. Okay, so into this first question, see, dash is the science and art of preventing disease, prolonging the life, promoting the health through the organized community efforts. So the answer goes to public health. Next question, the first contact person in the healthcare delivery system in our village level is the dash, that is ASHA workers, ASHA. ASHA means accredited social health activist. Okay, now come to the next, that is safe and clean drinking water can be obtained by boiling water for how much minutes? 10 to 15 minutes. Next question, communication which takes place without using the spoken or the written word is called dashed communication. So answer goes to non-verbal communication. Next question is write the short notes for the following. Okay, first, functions of the primary health care. So what is the PAC? As I said, it's a primary basic healthcare functional process where through the low cost they are going to they are providing the treatment as well as the basic procedures for the people who all belongs in that particular community, right? So see the functions. So PAC is the first point of contact between the rural populations and then the healthcare system. So the functions include, first is the medical care, like treatment of the minor ailments as well as the common diseases. Next one is the maternal and child health care. So among this including antenatal, postnatal, prenatal as well as the immunization schedule. Next one is the family planning, which is mainly counseling as well as the distributions of the contraceptives to prevent any kind of the STD, means sexual transmitted disease, as well as to manage the population growth of our India. Now come to the next topic, that is control of the communicable disease. How? By the survey as well as the early detections as well as the interventions. Next is the health educations. So mainly we have to promote the awareness about the hygiene, nutrition as well as the sanitations among the community people to prevent especially the infectious disease. Next is the environmental sanitation. So mainly we have to support for the clean water as well as the proper waste disposal. Next is the referral service. If we have we are getting any like complicated cases, so immediately we have to refer the patient from the PAC to the CIC, from the CIC to the district hospital, and they are not able to give the proper treatment, so that time from the district hospital we have to shift the patient to the urban hospital. Okay, so that is the basic change of the referral system we have to follow as a community healthcare nurses. Now come to the next question, that is safe water and its purification method. So safe drinking water, it's a free from any pathogens as well as the harmful chemicals, right? So what is the main importance? First is prevent the waterborne disease, as example cholera, typhoid, hepatitis A, etc. Next is promote the hygiene and then good health. Okay, so what are the purifications method are there for the drinking water? First is the boiling. Boiling means kills most the bacteria, virus and parasite. Minimum 10 to 15 minutes we have to boil before drinking it. Then we have to kept it for the colding. Then we can able to drink it. Next is the filtrations, like remove the physical impurities. Next is the chlorination, like disinfectant water by adding the chlorine. Next one is the solar disinfection or the SODIS. So mainly they are using using the sunlight to kill the germs. Next is use of the water purifiers, which is able in the modern homes for the chemical as well as the biological safety. Next, move to the next question, that is water disposal method in the community settings. Okay, so see, proper waste disposal is mainly helpful for preventing the infectious disease as well as the environmental pollutions, right? So what are the common methods are there like for the waste disposing? First is the burning. Burning means we have dry waste, we can able to burn like paper as well as the wood. Next one is the burying. So burying is nothing but safe for the biodegradable waste in the rural areas. Next is the composting. Composting is nothing but we have to convert this organic waste into the manure. So what will happen, we can use as another form in this particular waste product. Next is the segregation. Segregation is nothing but separations dry and wet waste as a source. Okay, next one is the sanitary landfill. So mainly we had used in the urban area for the final disposal. Next one is the incinerations. So burns the hazardous medical as well as the industrial waste at the high temperature. So what will happen, all the germs as well as the microbacteria or microorganism, everything will be die in that particular incineration procedure. So these all are the basic water waste disposal method in our community settings. Okay, next question, barriers to the effective communications in the healthcare. So mainly as a nurse, when we are going to maintain the rapport along with the community people, so what will happen, there is one of the most difficult barrier we are facing, that is the communication barrier due to some language or due to some misunderstanding, right? So what we have to do, we have to use the basic and very general words what we'll be able to understand for them as well as for us also. We can't use any kind of medical abbreviation as well as a medical terminology while we are going to discuss regarding some disease conditions or the prevention or the management to the particular community people, right? So see, communication barriers, it's mainly reduce the effectiveness of the health education as well as the service delivery. So when you are going to give the proper care to the people and you can't able to do the proper communication, so whether you can able to give the quality of care to the particular people, no, right? So that's why communication barriers we have to like reduce. Okay, so what are the common barriers? Like language difference, like misunderstanding due to the different language as well as the dialects. Next is the cultural beliefs. So mainly its traditional views may conflict with the modern health advice. So suppose for the like for some people they don't like some like dietary habits. Okay, but as per the medical conditions we are providing the particular dietary habits to that particular people for the disease conditions. So what will happen, that time they will be misunderstanding the nurses, and what is happening, conflict might be happen in between them. Okay, so that is the cultural beliefs. Next is the post listening skills. Mainly what is happened, both the health workers as well as the clients, they may not listen attentively. Sometimes due to the busy work schedule, the nurses can't able to listen properly about the patient's problem, as well as sometimes due to the like they don't have any interest about the treatment procedure. So for that the patients are also not listening about the nurses words. Okay, so due to this some conditions, the quality of care is going to be effective. Now come to the emotional barriers. So into this fear, anxiety as well as the anger, which can obstruct the understanding. Sometimes if the patients they're not ready to listen the nurse's word or the doctor's word, as well as like due to this busy schedule, if they're continuously like misunderstand the nurses, so what will happen, sometimes the nurses they lose their anger, as well as sometimes due to the handling cases they are getting some fear and they're creating the anxiety situations. Okay, so for this kind of the situations, what is happened, the emotional barriers is going to be damaged, and for that they can't able to give the quality of care. Next is the lack of feedback, no way to confirm whether the message was understood or not. Sometimes from the other side they're not giving any kind of the feedback, so it's becoming as a one-way communication, and due to this one-way communication, what is happened, we can't able to understand whether they are following our words or not, whether it's going to be effective for them or not, right? So next is the environmental distraction, like noise, poor listening, poor lighting, as well as the crowded place, which is mainly disruptive the communication procedure. So move to the next topic, that is answer the following. So into this, first is what is the primary aim of the community health nursing? So community health nursing is nothing but it's a nursing specialization where the nurses, they are mainly take care about the community people, their health, their promotive, preventive as well as the curative health services they have to provide in that particular community settings with the help of the PAC as well as the CAC, right? So that is the actual community health nursing. So what is the primary goal? The main objectives of the community health nursing is nothing but for enhancing the overall well-being of the individual, families as well as the entire communities. How? By delivering a comprehensive range of the healthcare service, means by delivering the quality of care. Next point, this include the preventive measures for avoiding the onset of the disease, then promotive actions for encouraging their healthy lifestyles, curative service for the treatment of their illnesses, as well as the rehabilitative care for supporting the recovery and restore the health after illness as well as the disability. Next point is the goal is to ensure the accessible, affordable as well as equitable healthcare service at the grassroots level. Means is nothing but like the primary healthcare what they're going to give, it should be affordable for each and every people who are belongs into that particular community area, okay, as well as it should be very much accessible for all the people who all are coming for the treatment, basic treatment, okay. So as well as equitable in the sense like a treatment of the treatment for the diseases as well as the disease conditions, it should not be depend on any kind of the physical barrier as well as the emotional barrier as well as the financial barrier or any other status of the people, okay. It should be equal for each and every people at the grassroots level, means from the starting onwards it should be too much equal for each and every person who all are coming into that particular area or particular PAC or CAC center. So they have to improve the quality of life as well as reducing the burden of the disease in the community by providing the proper awareness, by providing health education as well as the immunization, etc. So that is the mainly primary aim of community health nursing. Now come to the next question, that is define the balanced diet. So what is the balanced diet? It mainly refers as a nutritionally adequate meal plan which is mainly including all the essential nutrients which is needed for our daily life, such as carbohydrate for energy, protein for the bodybuilding as well as the repair, fat for the energy storage and then cell functions, vitamins and minerals for the regulating body process as well as water for the hydration and then metabolic functions. So mainly these nutrients which must be consumed in the appropriate quantities. If you consume more, it will be give you result as a different. So you have to consume in appropriate quantities as well as the proportional based on the individual's body mass index as well as the age, gender, physical activity as well as the health status. If you go beyond of your BMI or the body mass index and if you are consuming all the nutrients in much more level in daily basis, so what will happen? It will create the another disease conditions in your blood circulation system. Next, the balanced diet is mainly support the optimal physical growth, mental development, immune functions and overall the maintenance of health and ability. So this is the definitions of the balanced diet, okay. Now come to the next question, that is what is the pasteurizations of the milk? So pasteurization is nothing but it's a method which is used to make a milk safe for the consumptions by the destroying harmful microorganisms. So from the microorganisms consumptions prevention, they are going to pasteurize the milk for a drinking, okay. Next come to the process, how it's going to do. It mainly involves heating milk to a specific temperature, typically between 63 degrees Celsius and 72 degrees Celsius for a fixed period of time, as example 30 minutes at 63 degrees Celsius or 15 seconds at the 72 degrees Celsius. So what is the purpose? Main goal of this to kill the pathogenic bacteria such as Salmonella typhi, Listeria as well as the Microbacterium tuberculosis, which can cause a serious illness in our body. Now come to the nutritional retention. What is this? The process is carefully controlled so that the nutritional quality of the milk such as protein, albumin as well as the vitamin, it's going to be preserved without any significant losses. Now come to the types. So there are mainly three types. First is low temperature long time, means LT. So it is like 63 degrees Celsius for 30 minutes. High temperature short time HTST 72 degrees Celsius per 50 seconds, as well as the ultra high temperature UHT mainly 135 to 150 degrees Celsius for 2 to 5 seconds used for the longer shelf life. Okay, now come to the benefits of the pasteurization. First is improve the milk safety by reducing the risk of infection, extend the shelf life by reducing the bacterial load, maintain the taste as well as the nutrition better than the boiling. The process is named after the Louis Pasteur, who developed it into the 19th century for prevent the spoilage as well as the disease from the contaminated food as well as the beverage. Okay, so that is all about pasteurizations of the milk. So now come to the next question, that is what is the two main sources of the protein. So as we know, protein is one of the main nutrients which is mainly helpful for our muscle buildup, body buildup as well as the repair. So see, protein as the essential nutrients required for the growth, tissue repair, immune function and enzyme as well as the hormone productions in our body. So mainly they are obtained of the two major source, animal source as well as the plant source. So into this animal source, it's also known as a complete protein. So they're considering the high quality as well as the complete protein which they contain all 9 essential amino acid which is mainly required for the human body. So as example, meat, so such as chicken, beef, mutton. Next is the fish and seafood. So into this omega-3 fatty acid which is mainly helpful for our vision as well as for our bone growth as well as the bone strength. Next is the eggs, especially eggs white such as the albumin which is a pure protein. Next is the milk and dairy product like cheese, paneer as well as the yogurt. Now come to the characteristics. So mainly easily digestible as well as a biologically complete. Next, rich in the vitamin B12, iron as well as the zinc which is mostly absent in the plant protein, and it's ideal for the muscle building as well as the recovery. Now come to the plant sources, incomplete or the complementary protein. So mostly all the like plant-based proteins are incomplete, maintaining their lack one or more essential amino acid, but when combined properly they provide the complete protein nutrition also. So what are the examples like pulses and legumes such as lentils, chickpeas as well as the kidney beans. Then nuts and seeds like almonds, peanut as well as the chia seed and flaxseed. Next one is a whole grain such as brown rice, oats, quinoa which is an exception, it's a complete plant protein. Next is a soy product like tofu, soya milk as well as the soya chunks, it's a complete plant protein. Okay, now come to the characteristics. So what are the characteristics? It's a rich in fiber, antioxidant as well as the phytonutrients, and it's lower in the saturated fat which is compared to the animal protein, and it's also suitable for the vegetarian as well as the vegan diets, and it's also combining the cereals as well as the pulses like rice plus dal provide a complete protein profile. Okay, so that is the mainly two type of sources of the proteins. Now next move to the true or false sections. Okay, first, immunization is an example of preventive health service. Yes, that is true. Next, personal hygiene has no impact on community health. Obviously the statement is false, because if you not maintain the personal hygiene properly, there is a chance to get the infection. So if the whole community people are doing like this, obviously it is going to be impacted the community healthy life, right? Next is the proteins are the main source of energy in a balanced diet. The statement is false. No, proteins are not main source of energy. Main source of energy is like carbohydrate plus fat. These two all are the main source of the energy. Now health education aims only to increase the knowledge, not to the change behavior. No, that is false. Health education is emphasizing in the behavioral changes also. Okay, now come to the next that is short notes. Okay, so into this, first define the health and mention its dimensions. This is one of the most important questions for your exam. So health is the state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. So this definition is given by the WHO or World Health Organization, right? So mainly it's a holistic concept which is mainly emphasizing the balancing as well as the harmonious state of our life, right? So see the dimensions. First is the physical dimension. So physical dimension is mainly referring the normal functionings of all the body organs as well as the systems. So mainly it's indicating absence of any kind of the disease, injuries as well as the proper with sufficient proper energy levels, proper nutrition, as well as to ability to carry out of the daily physical activities without any kind of the fatigue or dizziness. So that is called a physical dimension. Now come to the mental dimension. So mental health or mental dimension mainly involving the capacity to think clearly, reason logically, as well as make the sound decisions. Means based on the situations we have to make a proper decisions, and based on that we have to do the work. Okay, so that is called the sound decisions, and it's also going to include the ability to cope with the stresses of life, adapt to change, and maintain the psychological resilience. So next is the social dimension. So mainly they represent the ability for building as well as maintaining the healthy interpersonal relationship. Okay, so it's mainly including effective communications, which is mainly cooperation with the others and participations in the community or the social activities. Next is the emotional dimension. So mainly they're going to refer the ability to recognize, express, and manage the one's emotion appropriately, which is include the self-awareness, emotional stability, and then capacity to handle both positive as well as the negative feelings in a constructive way. Next is the spiritual well-being. So mainly they're indicating a sense of the purpose, peace, as well as the connections with something greater than one itself. And it's also involving the religious belief, personal values, ethics, as well as the practice which is guiding behavior, as well as the offer the inner strength during their life's changes. Okay, next is the vocational dimension. So mainly they relates the satisfaction and fulfillment in one specific professional life, which is mainly including the ability to choose, pursue, and maintain a job which matches the personal skills and interest while contributing meaningfully to the society. Now come to the principles of the home visiting. That is also one of the most important questions for your exam. So home visiting is nothing but it's referred as a planned as well as a purposeful approach for delivering the healthcare services to the individual or the families within the comfort of their home environment. Okay, and this method that allows the health professional for assessing, education, as well as support the families in a real life settings, which is mainly ensuring the care is accessible, personal, as well as the culturally appropriate. Okay, so while we are going for the home visiting, it should be pre-planned as well as a purposeful, and the objectives of the home visit, it should be clear out before itself. Okay, so while we are going for the home visiting, we have to, main goal should be, we have to like stick up all the objectives. Okay, so based on that, based on the family condition as well as the membership conditions, we have to disclose it. So that is the main aims as well as the main definitions of the home visiting. So see the principles. First is the need-based. Need-based in the sense each home visit should be tailored to the specific health needs of the family. So they must identifying existing the health problems, risk factor, as well as the gaps in knowledge, and plan interventions accordingly. So how much they knows about that particular disease conditions. So based on that, we have to provide more information regarding the disease. So if they will come to know from us, so obviously they can manage about themselves, as well as it should be too much effective for their care also. Next is the regular as well as the timely. So visit should be scheduled at appropriate intervals for ensuring continuity of the care, and then the timeliness is crucial to address the acute problems. It should be very clearly as well as monitoring the ongoing conditions very much effectively. Next is the purposeful. Purposeful is nothing but like every visit should have a clearly defined goals as well as the objectives, such as immunizations, follow-up, health educations, as well as the chronic disease assessment, management, etc., which is mainly ensuring the time as well as the resources which should be used too much effectively for quality of the care providing. Next is the flexible, means the nurse should be adaptable as well as the sensitive to the family's cultural practice, the beliefs, the daily routine, as well as the socio-economic condition. So beyond of this, we can't provide any balanced diet or any other treatment therapies for this particular family. So this helps in the building cooperations as well as avoiding the resistance for the family members. Next is the educative, means one of the core goals for our home visit is to empower the family with the knowledge related to the disease prevention, disease management, nutrition, hygiene, as well as the child care and self-care practices. Health teaching should be very simple as well as relevant, and the language is also very much understandable for the family members. Next is the respectful as well as the non-judgmental. The nurse must approach the each family members with empathy, respect, and without any prejudice or the bias. We can't judge the people by their socioeconomic status or any other cultural barriers. Okay, so we have to establish the trust, as well as we have to maintain a proper supportive relationship, which are the main key factors for the successful outcomes. Okay, so these all are the main principles for the home visiting. Next, move to the questions, that is methods of the health educations. So we know we have to give the health educations for empowering their knowledge, as well as improving their capacity, thinking capacity, as well as the reliability about the disease conditions, how to manage, how to prevent, as well as other clinical settings also. So see, what are the methods? Mainly health education is nothing but it's a process of imparting the informations and the skills, which is mainly encouraging the individuals as well as the communities for adoptions and maintain the healthy behaviors among the community people. So mainly it's aimed to promote the wellness, prevent the disease, and improve the quality of the life through the effective communication as well as the learning methods. Okay, so methods of the health educations is mainly depending on the type of the audience and then situation. So what are the methods? First is individual approach, means one by one. Okay, so this involves face-to-face conversation or the interaction in between the healthcare workers as well as the individual. Next, it's usually done through the personal counseling, through the interview, or through the private discussions. Next, it helps to address specific health problems, clarify the doubts, and the build trust for the behavior change of that particular people. Next one is the group approach, means some people should be there, like 6 or 8 members should be there, and the problem of that particular people, those people should be same. Okay, so in this method, the group of people is going to be educated together on a particular health topic. Next, the common techniques, it should be like group discussion, health talks, demonstration, role play, as well as a seminar. So they will get a clear idea about that particular disease conditions. So mainly it promotes the shared learning, peer support, as well as the active participations of the community people in that particular health educations. Next is the mass approach. Mass approach in the sense they are mainly targeting a large population at once with a various mass media through the communication schools. Okay, next mainly in examples including the poster, pamphlet, street plays like Mukkad Natak, as well as the radio program, then television shows, public announcement, as well as the social media campaign. So what will happen at once, many people they are getting that particular idea about that particular disease prevention or the management, and they are getting that informations also. Next, it is very useful for the spreading the health message quickly and creating the general awareness on the public health issues at the same time. Okay, next come to the overall this effective health education. It's mainly helping for informative, motivative, as well as the empower people for adopting the healthier lifestyle, prevention illness, as well as utilize the health services effectively. Okay, so these all are the method of health education. This is also one of the most important questions. Now come to the next, that is answer the following. Okay, first is what is epidemiology. Epidemiology is in nothing but it's a scientific study which is mainly focusing about the disease and then health related conditions, how it's going to be distributed across the different populations and what factors which is influencing their occurrence. Okay, so mainly it's involving the analyzing the patterns, causes, host factor, effective of these health issues with the ultimate goal of using the knowledge for preventions of that particular illness, promotions of the health, and control the spread of disease within the communities. So mainly epidemiology is nothing but it's a scientific study regarding the disease and its occurrence among the community people. Okay, so that is called epidemiology. Okay, now come to the explain in detail about the bag technique. So we know what is the bag technique. Bag technique is nothing but while as a community health nurse we are going for the home visit or the family visit, one bag we have to carry. Inside of that bag every article should be there, like basic use, surgical use, medical use, etc. Right? So each and every flap there is a some different articles. So that is the actual bag technique. See, the bag technique is a very systematic method which is followed by the community health nurse while during the home visit for carry out the necessary equipments and provide the care. The nurses specifically prepare the community health bag. So this technique is very crucial in the preventive cross infection between the patients as well as ensuring the effective and hygienic delivery of the care during their field visit. So mainly it promotes the efficiency, infection control as well as the readiness in community health nursing practice. So see the definition. Bag technique is a scientific organized procedure which is used by the community health nurses to utilize the contents of the community health bag during the home visit in such a manner which is minimize the risk of the cross infection between the patients while rendering the nursing care. So that is the definitions of the bag technique. So see the objectives. First is provide the safe and effective nursing care during the home visit using standardized procedure. Next, prevent the contaminations of the nursing supplies and equipment during and between visit. Next one is to maintain the cleanliness as well as the order lines of the community health bag. Then to utilize the time and resource effectively or efficiently in the community settings, and to promote the aseptic techniques in the field-based procedures. Okay, so what are the contents of the community health bag? So articles is generally used for like hand towel, then soap and soap dish, nail cutter, apron, tissue paper or the cloth piece. This type of the articles is mainly you can see in the side flaps. Side two flaps are there, so into this you can see it. Next one is the articles used for the medical or the surgical use. Okay, so into this kidney tray, artery forceps, scissor, gauze piece, cotton buds, then sterile dressing materials as well as the bandage. You can see in a outer compartment. Okay, these articles you can see in the outer compartment. Next one is the articles for the procedure like thermometer, blood pressure apparatus, stethoscope, syringe as well as the needle, spirit or the alcohol, disinfectant like Savlon, bleaching solution as well as the disposable gloves. So you can see in a inner compartment. Next one is the records and reporting material like register or the report book, pen and paper, forms, home visit, referral, health education. That also you can see in the side compartment. Okay, so there are mainly three compartments. Two side compartment, then one inner compartment and one outer compartment. So total 4 compartments are there. Now come to the next, that is steps in the bag technique or the procedure. First is preparations before the visit. So we have to clean and we have to check the community bag and refill with the necessary items like Savlons as well as etc. Next we have to wash hands thoroughly before and after packing the bag. Then we have to ensure sterile items. It should be separated from used or the unsterile articles. Next, during the visit, what we have to do, we have to like select a clean surface in the home and we have to spread the newspaper or the clean plastic sheet over there. Next we have to place the community health bag on the clean sheet in a like corner basis. Okay, suppose this is a sheet we spread over the floor and the community bag should be placed in that particular corner as a rectangle basis. Next we have to open the outer flap as a roll wise of the bag without touching the any inner compartments. Next is the wash hands with the soap and water or use a hand sanitizer. Then we have to add the apron and gloves if it is required. Then we have to remove only the necessary items for the procedure. Suppose urine analysis. Okay, so for that we have to give that culture bottle to the particular patient and we have to tell them to collect the urine. So after that, what are the things are necessary like Benedict solution, then speed lamp as well as like Savlons and any other articles what is needed, as well as like test tube holder. Okay, so everything we have to take from that bag and we have to keep it on the particular side of that particular sheet. Next we have to carry out the procedure, as example wound dressing, temperature measurement using the aseptic technique. Next we have to dispose of the used article in the kidney tray, wrap the soil dressing in a newspaper or the disposable bag and store in the separate compartment until the proper disposal. Then we have to wash and again after completing the procedure, again through the one end we have to fold the paper or the sheet and we have to keep it in the community bag for the next house uses. Okay, so this is the main steps of the bag technique procedure. Now come to the after visit. What we have to do, we have to clean the used equipment what we already used in that particular previous procedure with the antiseptic or disinfectant solutions. Then we have to re-sterilize the reusable articles as is needed and we have to disinfect it as well as repack the bag properly, and we have to documenting the care which is providing during the visit. Next is the principles of the bag techniques. First is aseptic technique. It must be maintained throughout the procedure. We have to minimal the handling of the sterile items for avoiding the contaminations. The articles should be returned to the bag only after cleaning as well as the disinfections. Cross infection must be avoided by the separating the clean and dirty items. Hand hygiene, it should be very critical before, during as well as the after procedure, and then bag should always be clean, dry and ready for the emergency use. So now come to the advantage of the bag technique, reduce the risk of cross-infection, encourage the standardized practice among the health workers, promote the hygiene and safety during the field visit, ensure the necessary supplies are the always available, and enhance the efficiency as well as the professionalism of the nurses. Now come to the disadvantage, like requires the discipline and attention to aseptic principles. Improper handling can lead to the contaminations of the whole bag, may be difficult to implement in very poor or unhygienic environment, and the bag must be regularly replenished as well as sterilized. So these all are the advantage and disadvantage. Now come to the next question, that is right about the disease cycle. So what is the disease cycle? It's mainly refers the sequence of the events which is involved in development as well as the spread of microorganism or the infectious disease from one person to another person, means through the host and its environment. So it mainly illustrates how a pathogen survives, multiplies, and it's transmitted from one host to another, so which is mainly leading as a disease propagation. So this is the understanding of the disease cycle is very crucial for the developing effective preventions and control the strategies in our public health service as well as the clinical medicine, right? So see the stages. First is causative agent or the pathogen. So mainly this cycle begins with a disease causing microorganisms such as bacteria, virus, fungus, protozoa, and helminth. Next, a pathogen, it must be capable for the infecting as well as the surviving within a host. Okay. Next is the reservoir for the infections. So this is the natural habituated for the pathogen lives, multiplies as well as the remains before entering a new host. So what is the example? Like human reservoir, as example typhoid as well as the tuberculosis. Animal reservoir like rabies as well as the plague, and environmental reservoir like tetanus soil as well as the legionella or through the water. Okay, now come to the portal of exit. So the route through which the pathogen lives into the reservoir. So common portals like a respiratory tract, as example through the coughing, sneezing in the influenza for the tuberculosis cases. Next is the gastrointestinal tract, as example stool in cholera as well as the typhoid. Genitourinary tract, as example urine in the leptospirosis, discharge in the STDs. Skin or blood, as example cuts, insect bites, needles, etc. Next is the portal of the entry. So the route through which the pathogen enters into the new host. So it's often mainly the portal of the exit, as example inhalation, respiratory tract, ingestion, gastrointestinal tract, and then broken skin, mucous membrane as well as the genitourinary tract. Next is the susceptible host. So the person who lacks the immunity to the resistance of the infectious agent. So the factors influencing affecting the susceptibility include like age, like infants and then elderly more vulnerable, immunocompromised state, as example HIV or the AIDS, cancer therapy, nutritional status, vaccination status, and presence of the comorbid conditions. Next is the exit as well as the continuation. So the pathogen, it exits the host and re-enters the environment or the another host, continuing the cycle, and without interruption the disease cycle, which leads to the sustainable transmission in the populations. Next is the multiplications and then pathogenesis. So once inside the host, the pathogen, it's going to be multiplies and causes the damage to the tissue, leading to the clinical symptoms. So the severity of the disease depends on the virulence of the pathogen, immune response to the host, and doses of the infectious agent. Okay. Now come to the last question, that is explain the family as a unit of health. That is also one of the most important questions. Explain the family. So family, it's mainly serve as a primary and then most influential unit, which is mainly shaping as well as reshaping the health and well-being of the family members. So it's mainly providing the essential physical, mental, emotional as well as the psychological support in that influence the health behaviors as well as the outcomes throughout and the individual's life. So from birth to old age, the family plays a crucial role in the disease preventions, health maintenance, care during the illness, and then rehabilitations, which is making it as a central focus for the public health as well as the community health nursing services. So what are the importance of the family as a unit of health? First is basic unit of society. So mainly family is the smallest yet which is most fundamental social unit where health values, beliefs, and habits they are first established. Next is it forms the foundations of the social norms and then behaviors, which is mainly including those related to the health. Next is health promotion and disease prevention. So families which promote the healthy lifestyle through the diet, hygiene, exercise, and preventive care like immunization, and they also teach the children's like health related behaviors by the example as well as the guidance. Next is genetic and then hereditary influence. So mainly the disease they have a genetic basis. So family history, they helps in the identifying the individuals at risk of chronic illness like diabetes, hypertension, cancer, etc., and early identification, which is mainly leading to the timely intervention and prevention. Next is the emotional as well as the psychological support. The strong family, they are providing the emotional security and helps the managers stress, grief as well as the anxiety. So the family support, it's positively influence the mental health and then coping mechanism for the patients. Next is the healthcare decision making. So families, they often make the crucial health related decisions, including when to seek care, the choice of the treatment and care during the chronic illness. Next, the cultural as well as the traditional beliefs with the families, which is mainly ensuring the health seeking behavior. Next is the caregiving during the illness. So family members, they are acting as a primary caregivers during the acute or the chronic illness, disabilities or end of life care, and they're assisting with the medications, daily care as well as the emotional support. Next is health education and awareness. So mainly nurses and then healthcare professionals, they are using the family unit for the health educations or the topics like nutrition, hygiene, family planning and then maternal child health. So it's coming as a channel for the spreading awareness and implementing the health program. Next is influence on the lifestyle and then behavior. So habits like smoking, alcohol consumption, exercise and then dietary patterns is a very significantly shaped within the family environment, and family discipline or supervision, which is mainly impact the adolescent risk behavior. Next is role of the reproductive and then maternal health. So families, they're influencing the decision regarding family planning, antenatal care, institutional deliveries and child rearing practices. So the supportive family contributes for the better outcomes in the maternal and then child health. Next is the health monitoring and then record keeping. So families, it helps in maintain the health records such as immunization like cards, medication history and then chronic disease management logs, and this data is a very essential for effective healthcare planning and then interventions. So the summary, family is a very vital unit for our health, which is mainly helps to for shaping as well as the reshaping of the individual and community health outcomes by providing the proper support, transmitting the health values and participating in actively in the care. Families serve as a cornerstone in maintaining the health as well as the preventing illness. So recognizing the family as a unit of care, it enables the health profession to design, implement the more effective, holistic as well as the sustainable health interventions. Okay, so all the important questions I discussed in these sessions. So tips as like suppose they're asking about the fill in the blanks questions, no need to write the questions, just give the question number and write the answer. Okay, suppose true or false, give the number and answer the true or false. Okay, so if the statement is false, write down the false and give the statement why it's false. Okay, so it will like attract the examiner. Yeah, you know something about this particular conditions, so they will be more impressive for your paper. And while you are going to give, like do the presentations for your exam paper, suppose for the 10 marks, so what you have to do, like what disease conditions or what are the conditions they are asking, based on that you give a small introductions. Okay, after that you come to the definitions. Then if it is a disease conditions in the community, so give the epidemiological triad. Okay, they try to give for each and every disease conditions. Okay, like host, causative organism as well as the environment. Okay, so like this triangle you just put and do the epidemiological triad, and after that whatever like information you want to give, just give. And if you don't know about that particular conditions or about that particular topics what they're asking, so related to that topic, just write it down something. Don't leave any questions, just fill all the pages as well as all the particular spaces what they are required for that particular questions, do it. And if you don't know about the answer also related the topic something, you just write it down. At least you will get half or 1 mark for that exam, sorry, for that answer. Okay, so these all are the tips, and if there you can able to provide some pictures also, you also can do. Even though if you suppose one question is the list out the principles of it of the health educations, it is a 2 marks questions. Okay, so no need to write all the explanations. Okay, just draw an image. Suppose you can draw a sun or sunflower or like tree, and from that you can write it down the principles 1 2 3 4 like this. Okay, so it will be more attractive. Like this presentation you have to do, don't leave any questions. If you don't know the answer also, write it down the answer as at least related of that particular topic. Okay, so you will crack the exam very definitely. And thank you for your supporting as well as for attending the live class. Again we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you.